You do after the Minister.
Thanks very much, Lascia and Corla. Excuse me. The Minister is unable to respond, obviously, because he can only speak once in the debate, which is unusual on a Tuesday and a Wednesday, but he can speak twice on a Thursday. It's bizarre, but that's the way it is. But I can say that he has listened carefully to what's being said, and he has told me that he will take note of this debate, which I think Lascia has been very sincere, very important. And I want to commend colleagues for the quality of the debate that I've listened to here for the last while. I want to thank deputies on all sides for their contribution, as I said, to this important debate on the health pricing and supply of medicinal goods, the Amendment Bill 2018. And I also welcome the opportunity to contribute to the debate. I appreciate the bill represents a really well-meant endeavour by Deputy Brazel to allow timely access to patients to new and innovative orphan medicinal products. I wish to acknowledge the considerable work which Deputy Brazel and members of the Joint Committee on Health have done over the past number of months in relation to orphan drugs. Really important work. In February 2018, the committee published a report which has been cited on a number of occasions this evening on evaluating orphan drugs. I know that the Minister of Health and HSE have given detailed consideration to the recommendations contained in that report, and as a result, a number of recent changes have been introduced to the assessment and reimbursement process within the confines of the 2013 Health Act, which provides a greater balance and transparency to the assessment process where orphan drugs are concerned. As every deputy is aware, a rare disease diagnosis poses particular difficulties to patients who are affected and to the people who care for them. Living with a rare disease is a constant daily challenge and places enormous pressure on patients and their families. And again, Deputy Louise O'Reilly mentioned people outside the gate, and we can see why. It is vital that these patients receive the best evidence-based, cost-effective treatments which our health service can provide. And I completely understand that access to potentially beneficial medicines for the treatment of rare diseases is a crucial issue for these patients and their families. And I want to join with Deputy Kenny, who said that nobody has a monopoly on compassion, and the Deputy is correct on that. We all feel that on all sides. The Minister for Health is aware of campaigns by parents and advocacy groups for access to orphan medicinal products, and he wishes to assure them that he, his department and the HSE continuously work to address issues around access for patients to new and innovative medicines. I wish to inform the House that the Government will be opposing this bill on the basis that the statutory process for assessing medicines as contained in the Health Pricing and Supply of Medical Goods Act 2013 is fit for purpose where orphan drugs are concerned. In 2013, following on from substantial deliberations, members of the Oireachtas put in place a thorough legal framework in the Health Pricing and Supply of Medicinal Goods Act 2013. This accords full statutory powers to the HSE to assess and make decisions on the reimbursement of medicines, taking account of a range of objective factors and expert opinions as appropriate. The Act specifies the criteria to be applied, which include the clinical and cost effectiveness of the product, the opportunity cost and the impact on resources that are available at HSE. While the 2013 Health Act did not establish specific criteria to be used by the HSE in reaching decisions on the reimbursement of orphan medicinal products, the HSE and the NCPE do consider issues such as the small patient numbers and the rarity of the conditions to be treated when evaluating these medicines. There is an acute awareness of the vulnerability of these patients and the chronically debilitating or life-threatening nature of many of these rare diseases. It is the Government's view that the criteria to apply to the evaluation process allows ample scope to the HSE to consider the particular circumstances that pertain to orphan drugs, including that oftentimes there is a high level of unmet need for these rare disease conditions. Deputies in the House have correctly identified that increasingly orphan medicinal products are being developed to target very rare conditions. Given the small number of patients affected by rare diseases, the pharmaceutical industry has been reluctant in the past to invest in the research and development of medicinal products to treat them. In the year 2000, the European Union introduced new legislation with the aim of providing incentives for the development of medicines for rare diseases. This intervention has proved very successful and has stimulated the development of many orphan drugs to date. The Government is fully aware and appreciative of the potential which these new orphan medicinal products can have in creating better health outcomes for Irish patients living with a rare disease diagnosis. Of course, we want all of our citizens to have access to the newest, most innovative medicines that are out there, and as quickly as possible. Increasingly, the orphan medicinal products which are being developed to target very rare conditions are coming with extremely high list prices, prices which in many cases go well beyond what our health service can afford. Health financial systems throughout the developed world are grappling with the challenges which these new and very often expensive orphan medicinal products pose. In many cases, the main driver of the price is an estimate of the maximum amount that health care systems can pay and is not connected to the health benefit of the treatment. Deputy Alan Kelly is correct. It is expected that the trend will continue towards more applications for orphan drugs in the years ahead. It is estimated that in the region of 45 new molecules, many of which will be orphan drugs, are due to receive market authorisation in Europe each year over the next 5 years. Therefore, there is not an end point whereby the pressure on the system to fund new products will abate. And that is why it is essential that Ireland retains a threshold incremental cost-effective ratio so as to ensure that decisions in relation to reimbursement of medicines are made on an objective and scientific basis, recognising the health needs of the entire population and other factors. The questions of affordability and sustainability remain major challenges for the health service in the context of our budget-limited health service. A less rigorous rule set for orphan products will not change this. The HSE is required under the Act to consider the funding challenges that these orphan drugs represent. It does this by drawing on the criteria contained in the Health Act, including the potential or actual budget impact of the drug in question and the cost effectiveness of meeting health needs by supplying a particular item rather than providing other health services. These are hard decisions which must be made in the context of the availability of finite resources in the face of ever-competing demands. Since the signing of the 4-year framework agreement on the supply and pricing of medicines in 2016, a significant number of orphan drugs have been reimbursed by the state. In terms of the availability of orphan medicinal products in Ireland, the Act is delivering and patients with rare diseases are receiving access to new and innovative medicines. To conclude, the Government is not supporting this bill as it is satisfied that the current criteria contained in the 2013 Health Act are fit for purpose when assessing orphan drugs. There is sufficient flexibility contained within the current legislation to allow ample scope for the HSE to consider all relevant evidence that pertains to orphan drugs. The Government is of the view that the 2013 Health Act is delivering on its objectives to provide new and innovative medicines to Irish patients, including those with rare disease diagnosis. The bill as tabled will disregard any threshold incremental cost-effective ratio in the assessment of orphan medicine, thereby removing an accepted, validated economic evaluation system for accessing medicines, and in doing so would dilute considerations around affordability and sustainability. The health service must look to care for the entire population, so every decision, including the reimbursement of orphan medicinal products, must be based on scientific assumptions, clinical evidence and cost-effective analysis as provided for by the 2013 Act. The Minister of Health is very aware of the human side of this entire process. Patients who are living with a rare disease diagnosis face enormous challenges in their day-to-day life, and such a diagnosis has significant repercussions for the whole family. These diseases can be acute or chronic in nature, and while there has been remarkable progress in advancing innovation for rare diseases, there still remain significant challenges in that there are many rare conditions which still do not have a treatment option. In conclusion, it is right that deputies assess and question the way we deliver health services to our citizens, and I would like to once more say that the Minister and I appreciate the conviction and sentiment behind this bill. The Minister for Health looks forward to further positive engagement with deputies in seeking solutions to address the challenges which we all face around securing more timely access to new and innovative medicines for all our citizens in a manner that is affordable and sustainable. And I'll certainly bring the comments made and the views expressed by all deputies here, Deputy Rabbit and Deputy Scanlon and Deputy Dr Michael Harty, to the Minister's attention this evening. As I said at the start, this is a very important debate, a very sincere debate, and one I think which will add to our thinking and progress into the future. And again, I want to thank Deputy Bradford for the work he's done in this matter. And as I said, the Minister does look forward to continuing to engage on this very, very important issue. Thank you very much. Thank you.